I'm Dennis Siegel. I'm a psychologist here at one of the developmental centers.
I'm Phil Cavelli. I'm a unit manager at the same developmental center as Dennis is.
Developmental Center is a place where people with intellectual, which means mental disabilities, as well as psychiatric problems, we call them adaptive challenges. They're placed in these institutions, these facilities, for purposes of trying to habilitate them, which means trying to teach them new skills, trying to eliminate a lot of the bad behaviors which they may have come into the place with, and at the same time try to make them ready to live in a community setting.
At our center here, we have about a population of about 420. Our ages are from the early 20s to the 90s. As Dennis was saying something about, from his side of it, that is that they do work with the maladaptive behaviors. From my side, as a manager, we have the care of individuals here. I also have to work with staffing here to provide the staffing for the care of the individuals there, which we both agree that our passion, the passion that we have here for our individuals is simply outstanding. We've seen our staff being very resourceful, how they look at individuals. They don't look at them as individuals, but as family members. And we look at our facility here as more of a family setting. I've been doing this job now for 37 years there. I remember I said I would be out here just for 5 years, and 10 and 15, 20 there. What I found is that you develop a passion for the people that you have to service here. Like I said, we know them by their first names. They call us by our first names. We do a lot of things. We do a lot of interactivities with the individuals there. So if we have birthday parties or things like that, we always do everything together. We have a lot of activities here that we do around the individuals here, around the people there. We do birthday parties, dances. Anything that we can do is that we wanted to make this place, this is their home. So we want to make it as much as a home-like environment for anybody that lives here. Really what they've done for me is that they showed me the joy that they have, and for what they have here and what I have, I can leave here at 8 hours. They really stay here, but they have shown me, they've taught me that to appreciate those little things in life that we take for granted.
I've watched particular men who, when I first came here, that didn't talk, didn't say a word, because of both the developmental level mentally, as well as really because no one really ever motivated them enough to want to speak. It's not like they couldn't, and it's not like people didn't interact with them, but they just didn't have that matchup. And sometimes you need that. You need those two personalities to get together, and I myself have experienced that twice with people here who didn't speak, and then one day I walk in and it's, oh my God, oh my God, oh my God. And then they smile at you. And then you go, are you doing good? And you hear them go, okay. And it is so fabulous. Because it's like having my own family, because I don't have children of my own. I have a stepchild. And it's so nice being able to know and to see someone grow like that. And I personally don't work here because of money. Because money for me is secondary. In my profession as a psychologist, I could make, in private practice, if I chose to, a whole lot more money. I don't make that same level of money here working as a state employee. What I do have as a sort of an adjunct to that, a supplement, is my health benefit.
It makes me feel like he's bullying us to come to the table there. It makes us feel as if we're not worth the time that we spent here. It's really a sad commentary on the governor, who's never come down to our places to actually see what his workers do there. So him to make those kind of comments there.
And the public needs to know costs do change, even in the private sector. And I always felt that the private sector should have the same as any other middle class worker. They should be no different than a state or municipal worker or whatever. Myself as a state worker and other county workers, etc., have always contributed towards the cost of running the state. We have been paying into the healthcare fund for shared costs since 1992. Unlike what's been advertised by the governor, we've had free health benefits up until very recently. Not
You
true.
would think that as the governor and the leader of the state, that he would say, "Look, I'm going to do this. I'm going to sacrifice this." But what he's done, he simply just said to us, "We need to sacrifice." Well, he's just, I guess, for lack of a better word, he's feeding off of us. He's not saying what he's going to do. So it seems like it's a one-way street. You do this, but I'll do this. And what it looks like is that he'll benefit from what we give up there. At the same time, he's unwilling to do anything to share the cost of the sacrifice. Because if you're going to sacrifice, that means we're all going to do it, not just a certain number of people. The sad thing about what's going on in New Jersey is that the governor, in his wisdom, or lack of wisdom, doesn't realize that there are people that are close to the poverty level, that if he's going to enact some of his stuff, his legislation he wants to do there, it's going to put a lot of people below that.
Sit down and negotiate.
Don't bully.
Don't bully.
Don't bully us there. And if you're really concerned about workers' rights and the rights of people in general, let's work together on this.
Most agree.
Yeah.